thanks for coming, everyone. This is obviously like a new concept, and thanks for all like taking part in what we're doing. We obviously want to look at collaborative working, products and different sectors to work together to deliver the best scenarios for our clients out there. So first of all, what we're going to do is introduce each of our, standing right in front of you, sorry, exhibitors that have come along and have got some products for us to use and put into practice. I'll pass you over first of all to Centrabed. If I pass you my mic actually, just so we can hear you, if you want to click one of them on. Thank you. And stand relatively close to each other if you can. Any sound issues, Kat, just put your hand up and let us know. Okay, so I'll pass you over to Centrabed and then we're going to go around each exhibitor individually.
Hello, so we're from Centrabed. My name's Charlie and this is Kim. So today we've got two products to demonstrate. We've got our Nile Leg Lifter. So we do a standard which is 25 stone, and we also do a 50 stone as well. So this is ideally to replace manual leg lifters, especially if obviously the arms are deteriorating with strength. So first we're going to go through that. So Kim, if you want to sit down. So we want to make sure Kim's sitting about a 45-degree angle. So what will happen is the inside leg will come off the floor. So then it's that both legs are then supported by the leg lifter. So your handset. So the handset's only got two buttons, just an up and down, black on white, so it's easy to see during the night time. We can start bringing our legs up, yeah. So once you get about halfway, you'll start to feel pressure at the back of your leg. So what that means is now it's time to start trying to shift your legs in and just tipping them over. There you go. There you go. So now all it's a case of, once the legs are in, it's just a case of positioning yourself in the middle of the bed. If there's side rails, you can use them. But you can leave this pillow leg lifter up as well. So it's not just a one-way thing. You can bring it down, you can bring it up. So if you need to get up at 3 o'clock in the morning to go to the toilet, you can just bring it up again and get your legs out. You're not stuck. But if you can get out on your own, which for a lot of people is the case, you can just put it down and just pull your legs out as you usually would. So if you want to try and get out, so you can either use leg lifter or not, whichever you choose, Kim. One thing I would recommend is to have a handrail, so that will aid the transfer. It gives you somewhere to purchase. And also if you've got a profile in bed, always make sure you have the backrest up a little bit. So that provides a bit of support on the back of the spine. Okay. So that is the leg lifter. It's very simple. So it fits onto the bed, onto these beds, all profiling beds, just with two brackets. All we need is the height of the bed if it's not adjustable. And we need to know the front width of the bed frame as well. So then we can make the brackets the right size to fit on. If it's to a divan bed, there will be straps, there will be legs and a back plate. So you basically ratchet on to the divan base. That way it can't move. So it'll only have about an inch's worth of deviation as you put your legs on it. So if I move this out of the way and we'll start getting on with the Arctic. Thank you very much. Yeah, if you want to go on the bed. So our Arctic bed was originally designed for the Duchenne community. As they get older, as most people know, mobility obviously starts declining. So it's a bed designed primarily for them. I'll just put the backrest up a bit more. Primarily for them, so it enables them to turn themselves during the night, stop mum and dad getting up or as many nighttime carers. And also if they're using the auto box will turn them automatically on a timer. So 3 o'clock in the morning, if mum's usually getting up, what the bed would do is it actually remove the pressure from one side and push it to the other automatically. So if we start getting on with the manual features, so the first thing is the backrest. So you can have that up, down, wherever you want. We also have knee breaks. The knee breaks can be individual or they can be done together. So you can either do left and right, or you can do it like this. Bring that up. We also have Trendelenburg. So this is a feature of all of our beds that don't have a X action. If you've got a really tight gap, then you would obviously need the X action Arctic so you can fit it in without worrying about having 6 inches extra either side. Start putting that down. So this will do standard and reverse. It's not just one way. We also have high-low as well. So high-low, once it gets to the top or the bottom, it will auto level. So it will bring the bed flat. So if you've got a carer that's particularly tall, we can even change the motors for longer stroke ones. So then it'll bring the bed up a little bit taller. Okay. And then the next feature is our turning. So with these handsets, every button apart from the last 4 is just standard profiling. So it's stuff that you've seen in the stores bed a million times anyway, so it's quite easy to use. So next we'll move on to turning. So we can leave the backrest and knee brakes in. We'll start bringing Kim towards us. So what this is good for when it comes to manual care, so if you're trying to change someone or get a slide sheet behind someone, instead of having to lift them that whole up to about 90 degrees, you're taking 50 degrees of movement off. So now I can get to Kim, I can put my arm behind her shoulder and only have to move her about 5 inches, which is a lot easier, especially if a client's a little bit heavier as well, than bringing them up from their back. You've got enough hands behind them, it's uncomfortable on the skin as well. So if I bring that one off a little bit, what I'm going to do next is put Kim into a shallow V. So this is good for if someone's got scoliosis or bad back issues in general. We can bring up both side turns. And what it's going to do is going to apply gentle pressure to Kim's hips. And what it's going to do is start making her spine. So any kind of deviations, it will start gently pushing them straightened. So this is particularly good for if someone's just had spinal surgery. And we have a lot of clients that have this. And then we'll have the bed for about 6 weeks while they recover. So I think the bed's just sensed. Yeah, so the bed's just sensed there's too much pressure on Kim, so it's actually just backed itself off. So it won't let me squeeze her essentially. So it's an anti-entrapment feature. And it's not letting me do it. Okay. Okay, so the next thing I'm going to show you is the other handset. So this is a very simple handset. So this is the main handset that came for the Duchenne community. So it's only got 4 buttons, and unlike the standard handset, it's really soft to touch and doesn't require much pressure. So during the night, if you've got a knee cramp in your right hand side, all you need to do is press 1 button, you can bring the knee brake down, but leave the knee brake on the other side up. So this is completely independent of the turn-in. So the turn-in can stay on its own, the auto box can keep running on its own timer, and you can just wake up, quickly move your leg, and then obviously get off back to sleep. Okay, so I'm just going to reset the side turns. We'll look at the auto box. That's it. Set down. So in order to use the auto box, you need to make sure the side turns are not active. So you can have knee brakes and all your profiling engaged. You can have a backrest, 1 knee brake up, 1 knee brake down, Trendelenburg and your high-low set, but you can't use the turn-in on the handset. It has to be completely flat, just to make sure the bed's set up right, because it works on a timing system. So the auto box, very simple box. It's only got 4 buttons on it. So the first button is for 30 minutes. B is for 1 hour. C is for 2 hours, and then you've got your reset as well.
I can't get in very close.
So I can try and bring it to you a little bit, if that's any help. So it's a very simple box. There's about 160 programs in the box, and it's just operating on a dip switch. So if you want to change the program later down the line, if it's already in here, we can just tell you which configuration to set it to. You just undo 4 screws in the back, move the dip switches, put screws back in. It's very simple. So if I set Kim on a 30-minute timer, so I know the side turns down, I've got 1 knee brake up, the other one is near enough down. So if I just set it off on a 30-minute timer, so what it's going to do now, it's now just bringing up Kim's left-hand side turn. So this is a very gentle one, I believe. I think it's 30 degrees. Yeah. So it's brought it up 30 degrees. Now what it's going to do is going to leave her for half hour and do absolutely nothing. So while that's sitting, I can bring the knee brake down. I can change the backrest. I'll bring you up rather than down, Kim. There you go. I can bring the backrest up, and it doesn't interfere with the auto box. So the side turning will just continue as it is. So for argument's sake, if a half an hour has been, so I just press the button again, what it's going to do is skip the cycle. So now it's going to bring that side down. It'll flatten that off. Yep. Right. There you go. And now it'll bring the other side up. So this one's just gentle, it's 30 degrees. We can make the auto box programs special as well. So if you've got something you particularly need, like a backrest and knee brakes to move at a certain time, we can incorporate them. By standard, most of the programs just do the turning to not interfere. But yeah, if you want backrests and knee brakes included, we can incorporate that into a program and get one made for you. So that would be added to the box. And the benefit is once someone adds one to the box, everyone else benefits from having the program. So it's not just for one person, it helps the community as well. So once you're ready in the morning and you're going to be going through changing and obviously getting out of bed, all you have to do is hold the reset button. And what that will do is it will take the side turns out. So it won't reset the backrest and knee brakes, because if someone needs the backrest up, obviously if they've got chest infection, stuff like that, you don't want to be taking the backrest out because that's going to be bad news. So once the bed's worked out where it is, it will then reset the auto box. And that'll take all the side turning out. Yeah, that's done. So from there, what I can do, if I can start turning Kim towards me. There you go. So while the auto box is resetting, it will lock you out of the handsets. It won't let you do anything. You can't press any buttons, or if you do, it won't let you do any, move the bed at all. So the last thing to go through is there's 24, 25 different standard colours. We have done TVR purple if that's something you want, so we can do within reason whatever you want. All of our turning beds come with theme panels if you choose. So if you've got a particular theme, then you can have that incorporated into the bed, so it doesn't just look bog standard or hospital like. It can be tailored to what you need. We do different types of rails. So for our paediatric version of the turning bed Caribbean, they come with the full length rails that go from the head to the footboard. They are the ones that conform with the most recent standard. We do 72-inch standard rails, which we've got on the other side of the bed. So these can be with with bumpers. We do padded or mesh, depending what you wish. If you've got the paediatric spec, they'll have some foam at the bottom for anti-entrapment, so you can't get your fingers underneath towards the metalwork and hurt yourself. Yeah.
I've got a little question.
Sure.
When you said with the, I know you probably can't hear me either, sorry, with the
auto box, yeah.
You know, you said you can't press anything to override it. Is there like an emergency stop?
Yeah, so if I set the auto box on, so the bed started moving, press the red button, it stopped.
Okay, so yeah, if we needed to stop it and you didn't want it to do that manoeuvre, you could stop it.
Yeah.
Okay. And that reset, so you can put that's like things like CPR or something like that. Is that something that you could? So we can build in to this button, we can build in so it flattens the bed off. But by standard, all it does is it's an emergency kill switch. So if you need the bed to stop moving for whatever reason, you quickly come in, press the red button, and it stops. Everything stops, cancels the auto box, and resets the controls inside. And would it go to a flat position, or can you?
If you want CPR, we can. Yeah, we could add that.
Okay, that's cool. Thanks very much. So what we'll do now is I'll pass the
This
mic over to
yeah.
Cora, please, if possible. Again, we should have probably put two.
I could have done
We'll
that.
do that next up, the next workshop. That's
Okay.
fine. But if you stand quite close, it picks up quite
Sure.
well.
That's going to take the chair.
Yeah,
Okay.
sure. All right, thank you very much.
Okay, good morning. Thank you very much for joining. My name is Matt Hamilton. I'm from Acora. You probably know us from a lot of community equipment. So we have a large array of equipment that we put into community services. Just for three examples, Kent, Essex and London are three of our main accounts down as we're in Kent today. I've got two products to show you today. One is the Comfort dual motor tilting space rise recliner, and also we have the Advanced, which is the true tilting space new portable chair that we've launched onto the market. So Acora is based around modular systems and around size, pressure and posture. So our aim is to be able to create a modular seating system for you that we can adapt and change for developing needs, as well as using with equipment services to recycle and reissue out into the community. The Comfort, this is a medium chair. So this chair is 20 inches in seat width, 20 inches seat depth, 18-inch seat height as standard. Within the system, we have dual motor tilt and space. So as the leg rest elevates, whole seat base then goes into tilt, and then you have an independent backrest recline. So this is designed for people who are ambulant or semi-ambulant users using equipment. You need a good level of extension at the knee to be able to sit in a comfort or in a rise and recliner chair. We also can use this with equipment with transfer aids. So again, using things like Sarah Steadies, Cricket, mini lifts, any of those pieces of equipment to aid with transfers of service users into the chair. We have a fully compatible frame, which I'll just bring up now. So as the front chair comes up, you'll see there's a horseshoe frame at the bottom of the chair. This allows you to get full good access with the transfer equipment. And also the chair is on casters. When the chair does come off the floor into rise, the front casters come off, so there's no chance of the chair moving. Within the rise as well, there's 3 options of rise. So at the moment, this is going into a medium rise. So this goes up first and tilts 20 degrees at the top of the rise. We can also do a vertical rise. So we can use that with people with MSM&D or someone who's using a drop-down armrest using a wheelchair, transfer board using a wheelchair. So again, we can do that within the chair. Pressure care, as standard, we have a visco cushion, medium to high prevention in the seat base and through the leg rest, as well as the backrest fabric and the top of the arms all being pressure relief. We can then make changes to the chair to increase the pressure relief. So if we needed to increase the cushion in the seat base to an air cushion or another particular cushion that your community equipment service issue or district nurses wish to issue, we can actually lift the seat cushion up, unzip the overlay. We have then the central core of your visco cushion, remove the central core, and we can then, if needed, drop in an alternating air system into the chair. The pipes for this then run out through the back. Obviously, on some cushions you may be used to seeing, maybe an Eclipse cushion, the pipes run out the front. We can then accommodate that if we need to with them pulling the zips together. But we're able to then adjust the chair to accommodate your alternating air. And then the pipes run out through the back of the chair. Like so. And your cushions go back on. We can then also adjust the posture options within the chair. So as standard, it comes with a waterfall backrest. We do have the option to remove the cushions. We can do something very simple, so like kyphosis or a scoliosis. We can turn the cushions vertically within the chair to accommodate that posture. All the cushions are adjustable with stuffing, and then again using the tilt and space of the chair to accommodate that type of posture. If we need slightly more postural support, we have additional options like a lateral support backrest. So again, for people with poor trunk control, we can fit that into the chair. And we also have a cocoon backrest, which again is a soft lateral support backrest, but can be really effective within the chair. We also do other more postural options and different head cushions as well. So that's a very brief overview of the comfort chair. We then have the advanced chair. So this is our new chair to the market, which is a true tilting space chair. So first of all, it is portable. It can move room to room. It has true tilting space, 37 degrees of tilting space. We can then elevate the legs, so we have full leg rest elevation and compensation within the leg rest. So as the leg rest rises up, it actually extends. And then we also have your backrest angle recline as well. So we can again adjust the angle of the backrest separately. So it's all independent. This option is powered. You can have a manual option as well. It does fit through standard doorways. So as long as it's a standard doorway width, 26.5 inches, it will fit through, no problem. And then we also have the option of additional lateral supports. So hopefully you can see there's external laterals on the chair. Again, we can use any of the backrests we've shown in the other chair in this chair, as well as upgrading the whole backrest. Adjustments in sizing, we can adjust the seat width between 16 inches and 22 inches in width, the seat depth between 16 and 22 inches, and the seat height from 13 to 21 inches. Again, it's a fully versatile tilt and space chair, which we've actually launched recently. Again, lots and lots of options available on it. If you'd like to learn more about either chair, or you'd like to have a joint visit, we have a range of our product specialists who are able to come out to your clients' homes or other environments and obviously bring chairs to try. Please just contact our office. Thank you.
Hi, I'm Warren from SUMED. We're based up in Hadfield near Glossop. Our company motto is healing and maintaining healthy skin. So all the products we deal with purpose. I'll just go through. We've just launched a new heel product. It's called a heel sleeve. It's a very stretchy polymer product with a moisturizing product inside the system, and it's designed to, if you've seen preventer products, big heel boots, offloading heel boots, this is so you can dress the wound, slip this on, and the person can still walk, so they're not restricted. And because it's got more holes in it, they're quite cool. It stretches, so there's movement, so you're not getting much markings. So that's one of our latest products on the market from us on there. Very soft. The other heel product we do a single use. Oh, sorry. This can be cleaned at 60 degrees, so it's reusable. It's not a throwaway product. We do a heel boot called the Hadfield heel boot, which is a foam boot with dimples. It's a single patient use. You've got a hole at the bottom so you can check the heel. Soft Velcro, so it doesn't mark the top of the skin. And as I say, it can be used on the elbows as well if needed on there, which we do. We do a few of these in the hospitals. It's one of their biggest sellers in the hospital market. Only comes in one colour. We also, because we do standard cushions and we go up to bariatric products, we do pressure mapping. So you can put a client onto the product, then put this between them, and you can see what the pressure is happening underneath their bottoms. We also do a bed version. This is Bluetooth, so it transmits a signal every second, so you can see it's a live images straight away, and you can see what's happening underneath to check to make sure there's pressures, if the cushion's suitable, or if you're on the mattress, just to make sure you're in the right position and there's no pressures building up. So you can change a lot of the products. You put the top product in, think it's going to do the job when you don't really need it. You could probably go down a couple of foam products to save costs in the long run. We also do an air product similar to Roho, if you've dealt with Roho in the past. This is a new product called System Polyair. It's a honeycomb design, so you're more stable on that. So when the person moves, the cells move with the person. And for setting up purposes, you have a gauge to set up. You have a little card that tells you, find out the spec of the hip size as well as the weight of the person. And then that gives you a number between 1 and 6. You pre-inflate the cushion and you work out the number you're looking for. So then you put the client on the chair, on the cushion, make sure their arms are off the armrests, and then you press the button to let the air out to designate the number you're after. And then this you take off. You can leave this with your client so they can check it whenever they want to. With carers in the care home, they can leave the card there with what settings it's done, and they can check it regular, once a day or once a week or once a month on there. We have cushions that will go up to 42.5 stone. On there. Then we do static air products as well, cushions. This will go up to 23 stone. We have one size at the moment, which is normally 18 by 18. This can be used on riser chairs, any static chairs. We have belts on it. It can come without belts, so it can be secured to the chair. It comes in a PU soft fabric, and it's a free layer product. So whenever you sit on it, if you put a set of keys underneath, you can't feel it because of the way it's distributed the air. So you can try that later. We also do gel products for commodes, and we also do a thicker cushion, a one-piece one, which can go onto riser chairs as well. This is a polymer, and it's cold at touch, but it does warm up on there. So that can fit on any commodes. We also do one pieces. So if you're looking to put it on foot plates, on chairs, wheelchairs, you can cut it to size and secure it onto the foot. So it's quite a nice feeling. We also do commode cushions, bath cushions. We do longer bath cushions as well with this material. It's like a beanbag situation inside with the fluid, so it never bottoms out, so it just moves with the client. We also do mattresses. We do standard mattresses. We do full replacement mattresses. We do bariatric mattresses. Very easy to use. It's a plug and play system. We do small cells, and they're low air loss. So they release about 7 litres of air over an hour. So it keeps the moisture control underneath the client so they don't get too hot. And they're all colour coordinated, so easy for repairing. And all the grey cells mean they're that's the low air loss cells. So the head end is static, so that you don't get the C movement. And then you got and then underneath the heels and the buttocks, so it keeps it cool there. So on that, and we have 58 cells in it, 29 top, 29 below. The ones that below are static, so the only movement is on the top cells. So you get a full immersion on the mattress, and they feel you can get an immersion is really good, and it maps very well. When we originally designed this, we've put a 5 centimeter foam, so you never bottom out, because if you can't get out within 24 hours, at least you know the client's not going to be bottomed out. They're completely safe. It works on a simple motor pump, very quiet. It's one of the quietest on the market. It's 30 decibels. So it's like a whisper. So a lot of people, they found it more comfortable. They didn't wake up in the night because of a noisy pump. We have 3 settings. We have the comfort, which is soft, medium, and firm. We have the 4 different times, 5, 10, 15, and 20 on the cycles. We have static mode. So if you put it on static mode for any reason, it will only stay on for an hour, and then it will go back to what it was set before. We have auto nurse mode. So that's when you're doing your dressings. That stays on for half an hour and then gradually go back to what it was set up before. We have auto dual mode. It's basically if you're trying to bring them down to go back onto a standard mattress, it will stay alternating for an hour, then static for an hour until they get used to the firmness of the mattress. They have the lock, low air loss. We have the power, supply, alarms, and on-off standby. And then we do the standard. We do up to 28 stone on that version, and then we do a bariatric, which is 50 stone. The 50 stone one has a 15 centimeter foam cushion underneath it. Yeah, then we have the static mattresses, which we go up to 50 stone. We also do the X-Deck 25. This is quite unique. It has, it's a hybrid with alternating underneath the buttocks and the heels. And it has an API sensors on the buttocks, so it never bottoms out. So whatever position you have it, it registers and it never goes below a certain depth, whatever position you're in. It can go up to 200 kilos and you can alternate it for 6 minutes or 3 minutes or have it on completely static. And you don't need to worry about CPR because the positions of the foam is when it goes down, you can just do it. You haven't got to worry about unplugging things. And again, that's a very quiet pump as well. So that's a new generation mattress.
Hello everyone, my name's Dave Robinson from Hospital Direct. Got my colleague Dave Bennett. So you won't get us mixed up because we're both named Dave. We're a UK manufacturer, you know, for 20 odd years. We're based in Shropshire, factory in Shropshire. So it's all UK made products, which is good. We do a vast range of community products and we do a vast range of acute products. Dave will take you through the acute side of it. I'll take you through the community side of it. I can't obviously show you everything because time doesn't allow. So I've just brought a few things to give you a slight overview of what we do. But what we focus on as well is a lot of knowledge and education, because often the small things make the biggest impact. So what I've got on there, for example, is a base sheet. It's got a satin panel. You may have seen them out in the community, but what in the community they are is an alternative to slide sheets in the acute setting, because it enables one, just a base sheet, improving independence, or two, adding a four-way sheet on top of that for carers that need to turn someone. Reduces the hands on the body and more comfort and dignity for the client. So the base sheet, for example, will be particularly good for independence. For example, if we look at someone getting into bed, then they may just sit at that 90-degree angle, and then move that, and then if they get into bed, then then they end up in this position. Yeah, I did that slightly easier because I've reduced the friction under my hips, but I'm over here. So if they just looked at how they got into bed and they sit in bed, instead of sitting on that 90-degree angle, if they just move the hips slightly to the footboard, then when I get into bed, I'm going to go higher up the bed, for example. So you may have a bed lever there that's taking you further down the bed. That means when you get into bed, you've got to move yourself up the bed. So just doing that slight angle, when you go in, you're going to go higher up the bed. If I want to get into the middle of the bed, if I'm sat 90 degrees and I just angle my hips slightly that way, so to the headboard, then when I get into the bed, I'm in the middle of the bed. Dropping the money. I'm in the middle of the bed. So just, it's not all about product really when we're managing things, but it's about just maybe putting a base sheet in to enable that independence, and then looking at a slight different technique of how you're getting into bed. We might have a larger person, for example, that is very close to the edge of the bed. And then when they come up to get out of bed, they feel like they're falling off the edge of the bed because they're too far off. We all get out of bed probably differently, but mainly that way. But if they just changed the way they got out of bed and then went this way and then come out of bed, they'd find themselves a lot more seated on the edge of the bed. So the base sheet obviously is going to help that rotation. So from rotating round under that hip, it's going to help do that. We also have the pillowcase that goes with this. Lots of reasons why we'd have a pillowcase. People with ear ulcers, the satin panel there, then you've got the head and the ear resting on the satin. Also proven to reduce wrinkles, but that's another area. I wish I'd had one years ago. But obviously any ear ulcers, you know, they've not got that. But it's also good if I want to get myself up the bed. It's got that slightly at the top of my shoulders. Is that when I want to push up the bed, it makes it easier for me to get up the bed. If I'm migrating down the bed, I might want to not use the knee brake. Sometimes when you use a knee brake, it lifts the whole leg and it's in that position all night. So because when you turn it around, it grips. So you've got the nice satin underneath the legs, and you've got that, and that'll, if the backrest comes up, that prevents that migration down the bed. So 101 things you can do with a pillowcase. So if we looked at the wedge, for example, it's another thing we supply. We have small, standard, we have a large wedge, the plus size person, but the wedge, for example, if you had the small one down the bottom, again, when we turn over in bed, then we dig our heels into the mattress, you know, to start that rotation of the hip. Again, that's going to give me a good surface to turn over. If we looked at the standard wedge, rather than someone sitting on the bed and falling backwards, that's going to give me that support, and it'll stable me in that position while I'm sort of like getting my position right to get into bed. Plus, if you're taking slings off, or you've come from a stand aid, you want to remove that sling, saves holding the person. The good thing about the base sheet is the satin, because if I put my knuckles on a cotton sheet and I do this, if I was doing it on a cotton sheet, I'd be pulling my knuckles off because they'd be burning, they'd be very hot because I've got shear and friction. I can do that all day on the satin panel. So when we get heel ulcers, it's because we look at, as we get older, the skin around the bone gets very thin. So obviously when people are turning over, they're getting that friction and it's breaking the skin. So that, it's the same when we're profiling up, a lot of pressure goes into the coccyx area. Well, again, you're just releasing all that shear and friction. So that's a slight bit of education, but it's a slight overview of how we use these smaller products. We do manufacture, we are a manufacturer, so we've got that ability to make things as well.
Yeah, good idea. Yeah. So on the acute side, hello everyone. I'm Dave Bennett, and I work quite a lot in the. Oh. You can hear him. So I'll talk loud.
There's two channels, so it shouldn't make any difference.
Is that all right? Excellent. Hi everyone. Yeah, as Dave mentioned, I'm Dave Bennett. So there's two Daves. I do quite a lot of work in the acute sector. So as I say, there's quite a lot of products that we do make within the acute sector. We cover all areas of hospitals, from mortuaries, radiology, operating theatres, and on the ward. We started the company about 27 years ago, manufacturing slide sheets. This is where our kind of main bread and butter came from before we started introducing a lot of small handling aids. So we'll be looking today at different slide sheets and products to reposition patients for discharge and that kind of thing. This was a set that we made up from a hospital that had they wanted to use two slide sheets, but they wanted to change the colours of them. So when they had one with handles, this is a flat sheet, 90 centimeters, by 200, so that will give you full bed mattress coverage. And so they didn't get them mixed up if they were too red. They had the flat sheet, which was yellow, and that always went on the bottom, and then the red one would be placed over the top. So during training, it was much easier for staff to learn how to use the slide sheets and not get the red one kind of underneath. Our slide sheets are multi-directional, so they slide in any direction and any way up. So this is a disposable version. We can do these in any size, probably got the largest range of capability to make any size of slide sheet available. And then we have a washable version for those that can launder. And again, these can be made in the same color or as a pair. We can change the colors of the handles to match so they look like a set. That's all launderable. We do a lot of work with intensive care, so you may want a product which is similar to the satin. This is called the Rotherham Roma. This is a breathable sheet, and again with a single flat slide sheet or one with handles. This allows the patient to be easily repositioned as well. So we'll cover a few acute products during today's workshops.
This afternoon, care homes first.
Yeah. Thanks very much.
So you can have any length you want within reason. So we do anywhere from 60 inches, 90 inches. I've done one the other day. We do what's called a Jupiter special as well. So if you've got someone who's particularly long or particularly short, and just a bit of a different configuration when it comes to back, knees and feet, we can make the bed exactly what size you need. So it's bespoke for that client, because you do find, yeah, because some clients might be say 4.5 foot and they're not going to grow anymore because they're 21, 22. So if you give them a normal size profile in bed, they're going to slide down, knee breaks won't work. Yeah, so we'd make it so it's a little bit shorter in the first knee break, a little bit shorter in the second one, and that way it fits nicely for the client. We can also do bespoke widths as well. So every bed is made to order. So we don't sort of keep too much stock of them, so to speak. But this one's a 42, so it's a little bit wider than standard, but will work just perfectly for most people unless you're very, very slight in the shoulders. But yeah.
If the electric fails, is there a manual adjust option?
On the, which one, sorry?
I'm thinking of the bigger advance.
On the advanced, yes. This one is this has a battery backup on it as well. So so you can have it plugged into the mains, or it has a long life battery on it as well. Yeah.
Okay, do you make padding for like the the bedside? So that's something central bed could do that.
Yeah, we don't do that. Yeah, we don't floor bed as well.
And you do it, and Decora do it for the floor bed as well. And do you do padding as well?
We can do.
They can do, and Zoom it. So 3 out of 4 can. So.
we could definitely look at it for the
to be fair, that is actually something that I used to get asked a lot about, different paddings to go over. So like the bed rail covers and head and foot boards as well. And also I got asked that a lot for seating, funny enough. Obviously chairs have got a lot better with padding and stuff, but for people like it in their arms and stuff, so I did get asked that. Right, so what we'll do is I'll go around and introduce everyone here from attendees' point of view. What's your name, where'd you come from, and yeah, just a bit about yourself, and then we'll get Kat to talk, introduce the virtual people, which we were hoping to have on the screen so you could see each other, but not gone to plan. So I'll pass you over first of all to Kerry.
Hello, I'm Kerry. I'm one of the event organisers for this event. I'm here obviously just to learn more about the products myself, as I do events and not products.
And Kerry's also going to be our glamorous model in the workshops as well, so give us as complicated scenarios as you can and we'll get Kerry to reenact them.
Yep, just say what you want me to do and I'll be doing it later.
Thank you.
So I'm Karen. I used to be part of the RISE team, but I'm due to start work in a care home on the 2nd of November.
Hi, I'm Sharon. I'm the Moving and Handling Senior Coordinator for East Kent Hospitals. So I do an awful lot around manual handling with the team there, and also work with my community discharge teams to look at what's best practice and how we can discharge patient safely into the community working together. I'm also a director of RQS, so Recognising Quality Solutions. So what that is about is I will support people in the community as well as acute care trusts, standardising manual handling, standardising products, standardising training, and looking at how to support and write policies. And today I'm here to support the RISE events with regards to deconditioning of patients, how our patients are deconditioning quite quickly. We've got some fantastic equipment here, as you could see. So we're going to be looking at playing around with that and looking at how we can decondition simply by just moving an arm or a leg to making sure we move these patients.
Hello, my name's Sue Lenahan. I'm the Moving and Handling Advisor for Kenton Medway Mental Health and Social Care Trust. Today I'm come to learn more about our challenging environments, our challenging clients and different environments that we work in might raise risks for them with the different pieces of equipment and trying to risks. I'm also here to try and offer any suggestions for how we could help with moving clients should anybody have any questions.
Hello, I'm Maddie. I'm an occupational therapy student from the University of Brighton, and I'm just taking it all in.
Well done. Hi, I'm Jane Miller. I'm the Principal Occupational Therapist at Kent County Council, and we use a lot of these products on our KCC, and to hopefully deepen my understanding of the products and their application. Thank you.
My name is Rachel Salverson. I'm a health and housing coordinator working with the rapid transfer service at the QEQM. I also take referrals from the community in the cottage hospital. So I go out and do access visits before people are discharged, and then I follow up afterwards. So
Oh, hi, I'm Jo Doubleday. I'm an occupational therapist. I've been specialising in moving and handling in the community for many years now, and I'm here today to keep my depth of knowledge up to date, look at all the new products available, to learn from my colleagues here. So yeah, it should be a really interesting day.
Kat, do you want to introduce some people? Yeah, just whoever's given their details. I know it won't be everyone. Do you want this one? Sure, no worries.
Thank you. Just going to make sure I can hear myself. Yeah, there we go. Okay, so first we've got Nancy Temsit. She's a specialist OT from NELFT in Essex. Then we've got Jo, who is a senior OT at St Andrew's Healthcare in Northampton. Then we have Laura O'Rourdian, sorry if I'm saying your name wrong. She's a band 5 occupational therapist in D2A Taunton. And we've got Jane Dolphin, who's an independent OT and moving and handling trainer. And we've just had Janet come in. She's the lead moving and handling advisor at Great Ormond Street. That's everybody.
There is others on there. Yeah. So everyone that's obviously said who they are and your background, the whole we want you to be involved. Please, if you've got any suggestions or issues or anything that you want to raise and you want us to replicate out physically, which obviously Ian will be here to capture on camera so you see it properly, please put a question in. Kat, if we're in the middle of doing stuff, just raise your hand and say someone's got a question, and then we'll go through that. So the first scenario, do you need to turn the camera off again?
I need to stop for a couple of minutes.
Yeah, okay, so what I'll do is if anyone just wants to grab a quick drink, now we've done that, if you want, we'll take 5 minutes and then we'll come and we'll start the workshop. So yeah, take a 5-minute break and we'll be back with you then.